So all of these injectable drugs that we're seeing on TV, from Humira to Skyrizi and a number of others, we certainly always want patients to get the help that they need, but we also know that these come with a very significant cost, with the average for Humira being over $65,000. And we get into some of these others, like Skyrizi, we're well into the six figures on how much that's costing the health plan each year, which we know is ultimately passed on to the bottom line and the employees. So if there's a more effective avenue that we can have to obtain these medications, that's advantageous. Unfortunately, as Kramer reminds us, there are certain situations in which companies can write things off. And fortunately, the manufacturers of these medications have created grants, foundations, what we call MAPs, and some other programs that can be an avenue to both yourself and the patient getting the same medication in the same package at much lower or possibly no cost. And the reason these pharma manufacturers can do that is threefold. Number one, it helps their tax liability. Number two, it's goodwill and PR for them. And third, and actually most importantly, it helps with their Medicare and Medicaid strategy. The way they make a lot of money is obviously on those patients, and they can charge the government a different amount based on how much they give away in a charitable manner, like we're talking about here. So ideally, we can take these avenues and we can turn that 65,000 and that 113,000 into $0 for about half of your patients that are taking these medications on the plan. So how is that possible? So what we do is we contract with a third-party advocacy firm, and I've put a few of them on the page here, and it's actually a relatively simple setup. So we take your current administrator, which let's say is UMR, and we have UMR and whichever partner we choose, let's just say it's this top one here, Payer Matrix, and they work together to restructure your SPD language to take the primary coverage for these medications and move it over to the advocacy program. And these companies have advocacy teams that scour through all these grants and foundations to find an avenue to get that medication for free for both you and the patient. And ultimately, that SPD language is structured that if that person does not qualify, let's say they're an executive making 150 grand and they just don't qualify for any kind of program, we can route that right back and cover it through the health plan as a standard service and still have it be reimbursable by stop loss as well, if you're thinking that in the back of your mind. But one of the keys that we want to do to this is make sure that the HR team is an advocate for the advocacy firm, because that really helps create that goodwill relationship between the employee and the advocacy firm. And what a lot of HR teams have actually done is they have taken anybody who successfully goes through that program, whether they get the medication for free or not, and they have taken a gift card, $250, $500, and given that to the employee as a goodwill gesture. So naturally, when we're looking at removing $65,000 or $120,000 from the health plan, $500 is certainly a nice little carrot for the employee. So a couple questions that you may have going through your mind. How do we make sure the patient always gets their medication? That's always paramount, whether it's through the advocacy program or what we call a bridge fill, where we're able to temporarily fill through the health plan. We always make sure that that patient gets their medication. Question number two, is this legit? Absolutely. There are public entities, there are private entities, and everybody else that are taking advantage of this strategy right here in southeastern Wisconsin. Number three, what do the pharma manufacturers think of this strategy? Obviously, they're kind of balancing the scales on how it affects their bottom line through those three strategies I mentioned before and the actual cash price of those medications. So they are going along with it for now. That may change in the future, but the idea is if they're going along with it now, then let's strike while the iron's hot and take advantage of it while we can. So there are three different kinds of partners in this area, and they operate in three different ways. Some of them might do a percentage of savings where they take a shared savings amount and then they charge you a certain amount based on what they take off the plan. Others will do a straight per employee per month, and they will charge you based on the number of people you have on your health plan. And some will even take $0. So that's usually contingent on you working with their PBM that they're partnered with or that they're built into internally, but there can be a $0 avenue to this. So